On this episode of the show, I have with me Matt Pavelle. He is co-founder and co-CEO of Doctronic, and we're going to be talking about a little bit about AI in the medical space, specifically doctors and medical professionals. So we'll talk about, well, are they being replaced? Are they not being replaced? Where does AI and Gen AI and LLMs fit into that medical space? And how much of this is privacy versus anonymity? And Matt will talk to us about that a little bit, talk about tracking data, training data, a whole bunch of data-related stuff. And Matt, I'm excited about this one. Thank you for taking the time.
Yeah, I'm really excited too.
All right. Well, tell us what you guys do there before we start.
So Doctronic is the number one AI doctor, right? We have an AI. It functions pretty well as a doctor. It's free. It's anonymous by default. But we also have a human telehealth practice behind it, right? So we employ a bunch of doctors. Only in the States right now, but they're all licensed in all 50 states plus DC. So, after you talk to our AI, which is super accurate, you can take that for free and go to any doctor you like, or you can see our doctors. And we're available 24/7. We're pretty cheap. We charge $39 for a video visit. Usually the whole process, start to finish, of talking to the AI and then having a prescription or whatever you need in your hand is about 30 minutes.
That's faster by at least half to a lot of visits that I go to. So that could be a whole episode itself, but we'll table that for another day. This episode kind of going to dive into a little bit of understanding of what that means for us all. And before we start, I guess talking about doctors and talking about patient care. When we go see a doctor, we go and we're trying to tap into that person's knowledge base. And all of a sudden now we have solutions that can replicate, assist, co-pilot some of that knowledge. I guess when you look at people and their historical relationship with doctors, that in-person visit, is that just born of habit? Is that something that historically has had a big precedent? Is it something that you're seeing change?
Yeah, for sure. There's a lot of change going on now. I think the change started a long time ago. AI is accelerating it, certainly. There was clearly a time when doctors were, the only people that had access to this medical knowledge, and that was, a rite of passage. They had years and years of training, and that's great, right? Like, you had to see a doctor if you had medical questions. In the 60s and 70s, and people started writing more books about medicine specifically that were more for the consumer, right? Not just for other doctors. And, the access to that sort of information started to expand. I remember, growing up in the 80s, we had our Encyclopedia Britannica, and it was like, there were updates that were published every year, and half those updates were, medical. So the information started to get distributed and such. But I mean, until recently, you still really needed a medical degree in order to parse all of the information properly and explain it. Which is why a lot of people have or have historically had pretty poor results, looking for information on WebMD or Dr. Google or whatever, right? It's the information is kind of there, but you still almost needed a medical degree to figure it out. And now with AI, that has certainly changed. Some ways for the better, and some ways not. But I think there's definitely a democratization of knowledge going on, and I think the democratization of healthcare should follow quickly.
I was thinking about Doctronic. I was thinking about our interview, and it made me think about physician assistants. And I think when physician assistants first came on the scene, people, do you want to see the physician assistant or would you see the doctor? And I think everyone thought, well, I'm going to wait to see the doctor. And now you go to urgent care, a physician assistant typically steps in or takes care of you. Or I've even gone to dermatology appointments and a physician assistant comes and takes care of you, and it seemingly is becoming much more common, and we're more comfortable with it. And I guess the next question is when it comes to us humans and us getting comfortable. I mean, it takes us a little time, but when you're looking at the evolution you talked about, even WebMD, I think half the time people would go onto WebMD and be confused because they're like, there's so much information, 90 things fit. Humans have tried this. I guess when it comes to Doctronic, and you're looking at adoption, I guess what were some of the early concerns of just looking at the problem space and going, we got to get people to actually use this to make it work?
Yeah, I mean, we started building Doctronic in January of 2023, and launched it in September of 2023. So it's been a while. And the very first iteration, the question that my co-founder and I wanted to answer was, can we make AI medically accurate? Right? My co-founder is a doctor. I'm not. My wife is a doctor. My mother-in-law's a doctor. I got all the doctors in the family, but I'm not a doctor, right? But we just wanted to figure out, can we actually make the AI medically accurate? And if we can do that, would people still want to engage? And so, that was kind of the fundamental question that we were the fundamental questions that we were trying to answer in order to figure out whether there would be any growth potential. Interestingly, thinking about your comment about how people want to see PAs instead of a doctor now, and this is kind of a spontaneous thought, but I wonder if a PA now is as educated as a doctor was 40 years ago, right? My guess is they are, right? My guess is they have that same level of knowledge, maybe not the same length of education, but that same level of knowledge. And I think we're just kind of moving along those lines, right? I think our AI, as it has been built, because we're the only AI that has essentially published a paper, run tests, looked at this, where we've started kind of with a blank slate. The AI essentially says to a patient, what's wrong? And then the AI is responsible for asking all of the questions and continuing to try to gather enough data until it feels it has gathered enough data to make a diagnosis. And then, since we have doctors working for us and people see doctors, we know whether the doctors agree with the AI, right? And we've got that 99.2% alignment in the treatment plan with our AI and our doctor. And I think this is just another kind of point where, okay, maybe the PAs are as good as doctors were a while ago, and now maybe our AI is as good as PAs and doctors are now, and maybe the AI gets better for some of those things where you can actually work on them, diagnose them in a telehealth style visit, right?
Absolutely, and that's actually really interesting. When you're looking at doctors, and I brought this up because I was like, we're seeing so much movement in the software development space when it comes to tools, because people understand that space. The people that are developing these tools, they live and breathe the space. So obviously, some of these LLM tools that are coming out for helping engineers write code better, they're coming along quickly. Yeah. When it comes to this space of medical knowledge, I mean, there's a lot of medical knowledge that's established. I mean, yes, there's new stuff, and that's maybe a separate question. But when it comes to the existing stuff, the AI itself, once it's learned about the medical conditions and you're prompting it, for a person using it, if you go to the doctor, I'm assuming, I'm not a doctor, I'm going to pretend, you have doctors in your family at Abundance, so you probably know this better than I do, but they're going through some kind of decision tree in their mind. They're asking you symptoms, sure. They're checking things off. It seems to fit very well for an AI to do something similar, to go through that same decision tree path and start coming down to a smaller subset of issues.
Yeah, I absolutely, right? It's a perfect fit. And in fact, the way we modeled our AI is we actually have a series of kind of micro agents, and each of them have their own clinical guidelines that are written by our doctors, which is what kind of grounds them in this medical truth. But we have an AI that is very specifically, for example, focused on gathering your social history, or gathering your family history, or looking at all the symptoms that you may have associated with, say, hypertension, right? And so we have all of these like individual agents that are hyper focused on just that. And it's modeled on the way a doctor remembers, like, oh, okay, well, if I'm asking about hypertension, or if the person has hypertension, I need to remember all of these things. And then they shift context just the tiniest little bit. Okay, they also have diabetes. I have to remember to think about all these things. Instead of just the human mind shifting that context, we're just passing it off to a separate agent that does the exact same thing. But it has all of the most up-to-date guidelines immediately accessible to it. And that's all it does, right? And so it works faster than a human does. And for a lot of the lower acuity, easier, that we like to call it the easy 80% of advanced primary care, it's as good, if not better, than most doctors. And there's definitely a level of kind of like doctor knowledge that surpasses AIs right now that we're not focused on and we're not dealing with. And we don't expect to replace specialists ever, and we don't expect to replace primary care doctors for most of the hard stuff that primary care doctors do. But we think that there's probably a world where a lot of the easy things that primary care doctors take care of right now that they feel is possibly too time consuming and keeps them away from actual patient care should be passed off to an AI.
Absolutely. I'm going to come back to privacy in a second because you mentioned
Oh
something
yeah.
about capacity of how much a doctor can do in these settings, and they are going from room to room to room. I actually went to see my doctor, had my yearly checkup, and I actually for a second stood outside the room waiting for something, and I saw the coordination. I'm like, this is mapped out to science to get this guy to be optimal with his time. When you look at the amount of patients a physician can see, whether it's in urgent care, whether it's your personal physician, they are capped out. We're waiting. It takes. I can't even get an appointment if I'm sick to go see my personal physician. I have to go to urgent care. I mean, they're part of a hospital system out here. He already says if you're got a cold, urgent care. If it's not working out, then come see me. I feel like even then you go to urgent care and I'm waiting between 30 minutes to 3 hours to be seen
Right.
for what probably could have been distilled in your 30-minute session.
Yeah.
So when we think about capacity, we think about the amount of demand that's out there. How does AI, and obviously we know how it's going to help accessibility, but when it comes to actually triaging those patients, what happens to the doctors? I mean, you mentioned more time with patients. I'm not going to ask about the insurance impact because that's a whole different. I don't want to get anybody in trouble. But what do they do with that extra time? Do they get to spend more time with us as patients? Is that kind of what you're envisioning?
Yeah. So there are not enough doctors, right? That is totally clear. In primary care, where we focus, that's actually where the largest shortage is. Primary care doctors are kind of paid the least, and there just aren't enough people that want to go into the field. And by the way, the replacement numbers are worse, right? So the problem is just getting worse, and the ship has sailed on fixing that. It takes a decade to train a primary care doctor, right? We would have had to start 10 years ago. We didn't. There are not enough. There will not be enough. And people are also becoming more aware of their health. They're starting to ask more health questions. I think that's legitimate. Wearables are starting to expose a lot more issues ahead of time. That's legitimate. Let's see. Are doctors going to be able to see more patients, or are they going to be able to spend more time with patients? I think the unfortunate answer is that they're going to have to see more, right? At least initially. AI is going to make it so that doctors don't have to do a lot of the things that are currently bothersome that cause burnout right now. So, for example, with our medical practice and our doctors, because the patient spends the first 10, 15, sometimes 20 minutes talking to the AI, and the AI essentially suggests 4 diagnoses and 4 treatment plans. And again, there's a 99% alignment with doctors on that. We pass that to our doctors. So our doctors, don't have to do that. When you go into a doctor's office, someone is saying to you, so what's the problem? What are your symptoms? Tell me about what prescriptions you're taking. The AI does all of that, right? And it does so perfectly. And then it gets those all of that information taken care of, and it comes up with the diagnoses. So the doctor just kind of gets to look at it and say, okay, I understand this. But we go further than that. We actually build the doctor's note ahead of time. So my mother-in-law, who works at NYU, she spends, her week seeing patients and Sundays charting, because that's just how doctors work. They don't have enough time to actually write all their notes, and they do it on the weekends, and it's awful, right? It causes burnout. Our AI writes the note too. It writes the insurance paperwork. It does all of it. So, at least right now with our doctors, we are really efficient, and the doctors get to spend a meaningful amount of time having a conversation with the patient and caring for them. So the immediate answer is we're making doctors more efficient. I sure hope that we can get some of the easy things out of the way where the AI can maybe take care of all of it, so that not only are doctors more efficient, but that they'll be able to spend more time with patients on the hard problems.
I love that. And I guess when it comes to, making patient care accessible, you mentioned democratization. Obviously, we talked about, doctors who have to go to school, they have to spend extensive time, getting prepared for their discipline. Physician assistants are catching up in terms of their breadth of knowledge. When you mentioned democratization, and obviously in AI is the initial touch point, I guess, it's funny is, and this is something that went into my head because a couple of weeks ago, I actually popped onto the platform. I had a sty infection, and I was like, I'm just curious what it's going to tell me, which, truth be told, it actually was very, almost word for word similar to what my optometrist said. Instead of going onto...
By the way, that means you have a good optometrist, because we have top optometrists writing all of our guidelines. So good for you. That's
there you go.
There you go.
I like that. I would have jumped onto ChatGPT or something similar, or just flat Googled,
Yeah.
I have this, and I found myself going, oh, this is interesting. For some reason, I feel like it was more specialized and more accurate in the questions I was asking. I guess
Yeah.
I guess the question in here is, when you are looking at the alternatives and people do them already, how do you guys differentiate? Obviously, I know you have a medical practice behind the scenes, but up front, ChatGPT, Doctronic, just plain old Google, how do you differentiate to get people to actually go, hey, you know what? We are a specialized platform for this type of device.
Yeah, I mean, if I'm being honest, we don't do a particularly good job yet. We're a pretty young company and we're working on that. But we are very upfront. Like, we do not train on user data. Our AI is trained on the clinical guidelines that our doctors write. That's what makes our AI work so well, and that's what we train on. And as a user, your data is safe. By the way, we are also by default anonymous, as we have kind of mentioned. So we're big privacy advocates here. We will only ever ask your agent's sex. That's it. After a conversation, if you close the window, it's gone forever. Unless you have an account, it'll never be linked to you. We don't even know who you are. And so, those are two big things that we try to communicate to people that ChatGPT does not do. Right? They do train on your data, and they are generally not anonymous. They've also generally had some data issues in the past. We are, HIPAA compliant. They aren't. But yeah, I mean, if I'm, again, like, being honest, we're not that great at differentiating right now, but people are still gravitating towards us for those reasons. I think we just need to kind of communicate that more.
Interesting. Obviously, yeah, again, people, we take time anyways, but once people, I think, realize that some of those features are there, and you touched on HIPAA, and maybe a good segue quickly, just to touch on privacy, because you said also that the platform's anonymous. So
Yeah.
I would kind of like to understand, I'm sure somebody out there is like, they're going to take my data again. So talk to us a little bit when it comes to specifically this space of medical information. Obviously, we all know and are aware of HIPAA. When it comes to engaging with an AI agent, what happens? Is anything different? Is it the same, or what happens?
Well, if we're talking about the anonymous aspects of what we're doing, unless you make a user account with us, we have no way of knowing who you are, and we never ask, right? Like I said, we'll only ask your agent sex because that's medically relevant. We don't track your IP address or any other information like that. And so any conversation with us, we simply don't know who you are. Close the window, it's gone forever. If you don't make an account, you can't get it back. And we do have people who write into support and they say, oh, like, I forgot to make an account. Can I do this? And our answer is like, we have no idea who you are. We have no idea where your chat is. You just need to do it again. And, maybe it's going to take you another 20 minutes. So, the HIPAA compliance is actually super interesting. We are HIPAA compliant. We follow all the best security practices. We're encrypting data at rest. We do all of that. But technically, if you're just having an anonymous chat with us, you're not actually seeing a doctor yet, so we don't have to be HIPAA compliant, but we still are, right? We do that because we fundamentally believe in security and privacy and data rights and such. Anybody can obviously always ask to delete their account at any time, and we'll happily do that. And we never share. And frankly, you can take your data and take it to ChatGPT if you wanted to. But we do really focus on making sure that people feel secure and feel like they can use the system without any judgment and without any history and without any fear.
I like that. And I think maybe a lot of times when people are interacting with systems, it's interesting. Sometimes we do and sometimes we don't. People Google crazy things and then people tell ChatGPT a lot of things. But when it comes to specific domain tools, and all of a sudden, I think it enters in the landscape of someplace where we feel we should be more aware of it. And I think some of that comes into place. And when it does come, I mean, you mentioned obviously if you create an account, you guys track it, and you're doing a lot of the triage, you're going through that question and answer. A doctor potentially hops on, and you mentioned a percentage. Obviously, when you're going through the process, and at the end, you get a treatment plan, and you said free to take it anywhere, or you can compare it.
Yeah.
Obviously a lot of things. That treatment plan, I guess, go into a little bit of detail in terms of what that looks like. What's the confidence level? What does it look like when you get that, and Yeah, and I don't know if you guys track the success or maintain a follow up after that.
So with our doctors, we know. Um, Now, granted, there's like a bit of a potential data loss or a little bit of signal loss there, since we are by default anonymous and we are not tracking users. Um, if you choose to take that information to your doctor, we have no way of knowing, right? We only know what happens when you see our doctors. So, from an accuracy perspective, there is a bias that we acknowledge in our paper about this, where we only know the accuracy of when you actually see our doctor. We have no reason to believe it's significantly different if you go to see your doctor. But in our paper, we published that there was if you look at the top diagnosis, and there are always 4 diagnoses, and the top treatment plan, and there are always 4 treatment plans, 1 for each diagnosis, our doctors agree with the treatment plan 99.2% of the time. They only agree with the diagnosis 80% of the time, which is actually interesting. Now, the reason for the differential there is because in a telehealth visit, which is very similar to kind of the AI chatting or the telehealth visits that you have with our doctor afterwards, if you have something like, maybe it's a sinus infection or it's a throat infection, you can't actually tell on a video visit or in any telehealth visit which one it is. And honestly, it doesn't matter because the treatment is the same. You get thrown on an antibiotic, right? But no doctor can tell over a telehealth visit which one that is. And frankly, in a visit in person, it's often really hard to tell as well. Throat and sinus way too close. And there are a number of like dermatological cases where that happens as well. There's a rash and could be this, could be that, doesn't know, but the treatment plan is the same. So there is that point where we know that we're 80% aligned on that top diagnosis. We're 99% aligned on that top treatment plan. That's with our doctors. Also, in that 80%, when we know that there's like 20% where the AI and the doctor did not necessarily agree on the diagnosis, we dug deeper and we think the AI was right 4 to 5 times anyway. But again, the treatment's the same. And this is with, our doctors are top doctors, and we're really proud of that fact. So we do also feel like we're raising the floor of healthcare. This is part of the democratizing healthcare aspect that I speak of, right? We want everybody to have the experience as if they have a top trained doctor that is really focused on them, that is just listening to them all the time. And people don't get that everywhere.
It's standard of care is maybe something I didn't have on the radar to ask you about, but you bring up a very interesting, aspect of seeking medical advice. Standard of care from physician to physician, their knowledge, their recency in training, their follow. I mean, there's so many factors that go into bedside manner. I mean, there's so many little things that go into us having that relationship with a doctor. That standard of care, I mean, actually, for the STI, I went to multiple, ended up going to 2 ophthalmologists too. One gave me a wildly crazy diagnosis, so I had to go see a second one because I wanted a second opinion. I was like, what are you talking about? And it was interesting because the second doctor is checking the first doctor's work. We're dissecting it, and we start understanding where the lean was heavy on some data points. And she was like, you know what, maybe we did to just a revisit in 3 to 6 months because that's probably the right thing. Standard of care, I guess, being so variable and socioeconomically, accessibility to that standard care is vastly different as well. It is true. We might not like to say it, but it is true depending on what your insurance could pay for, HMO, all these different things. Your product just, I don't want it to sound like an advertisement, but I'm actually like going, okay, I see now. For let's say if I go through and I pay the $39, I am getting a standard of care that's a baseline. Now, I might not see a doctor, look, touch, and feel, but if it's something that's going to be diagnosable, that's a win. I'm actually just thinking about it. I didn't go through with your service and actually book the appointment because I was like, somebody's going to have to use the little slit lamps to look at my eyes. So I kind of knew that wasn't, but
by the way, our service would probably not recommend you see a doctor because we're not trying to sell doctor's appointments. Like, we give the service away for free. And at the end, the chat will only recommend that you see one of our doctors if it's something we can treat.
Absolutely.
So, if it's something that someone has to look at in person, we're almost certainly not going to recommend you even see our doctor. So you don't have to worry about selling us. Like we try to not sell ourselves half the time, right? Like we're just trying to give this away. And speaking of standard of care, again, the full diagnosis, the full treatment plan, and the complete doctor's note. We give it to you for free, totally anonymous. Take it to your doctor if you want. Worst case scenario, it's going to help your doctor, right? Best case scenario, it's going to make your doctor hyper efficient and give them information maybe they didn't think of to raise the standard of care.
I could keep asking questions, but maybe a couple more. And if I get to one that you're like, hey, Amir, this is we can't do it, that's fine as well. I am curious because as we're kind of getting into standard care, we've talked about privacy, adoption. I know we touched on it. Obviously, we're seeing AI tool adoption at different speeds, at different areas of everything. When it comes to this, I guess, and you guys are pretty new. I mean, I've been around a ton of time, but the product's there, it's functioning, working. What are you seeing from the adoption rates itself? Do you have any comments there?
Yeah, for sure. So we are growing very quickly. When we started, which was really when we started with doctors, human doctors in the loop, this was actually early 2025. They weren't doctors that we employed. And so we were a little bit gated by that because we weren't really happy with the quality of care that we were getting. So we decided to build our own doctor's practice. And so we launched with our own doctors, who are great. We love them. They're the best. We launched with them only about 8-9 weeks ago. But we are seeing, frankly, we're growing 50% month over month. Actually, it's a little more than 8 weeks now. We've had about four months of consistent 50% month over month growth. And so that's pretty good, right? Growing real fast. On the just general usage side as well, we've gone from 3 million consults in early 2025 to 17.5 million as of now. And so that's growing real fast too. We are still mostly in the US, and that's intentional. People can access us from all over the world, but we're mostly focused on the US because that's where we have doctors that can help people. But I sure hope we'll be able to go international in the next year or two in order to help other people that need it. We just want to make doctors more efficient right now, and we know we can do it, right? Our doctors say that our AI is like having the best chief resident in the world working for them for every single patient, right? It never says, hey, you've got a sty, but it's going to say there's an 80% chance it's a sty, there's a 10% chance it's this, 5% this. If it is a sty, this is the currently most up-to-date recommended treatment plan by ophthalmologists, and here are the other treatment plans if it's something else. That's just a hint. That's just a treat for a doctor. The doctor can say, oh, yeah, that all makes sense. Let's go. Save them time, make their lives more efficient.
If you were to put on your, I guess you're looking into the crystal ball of technology is rapidly improving in a lot of different ways of home robotics, computer vision, excuse me, obviously the one thing you mentioned is the look, touch, and feel. Like there's some things you can't do. Is there a world, and if it's outside scope, it's fine, but is there a world where we could surpass that? Because technology, I don't know if it's our phone, but cameras, I mean, if there is a technological solution to actually extend past the traditional, or not the traditional, but the solution you're providing, is that on the roadmap? Is that even something?
Oh, yeah, for sure. And by the way, like a lot of the tools already exist to enable a good chunk of that, right? Your wearables are tracking, your heart rate and your breathing rate, and frankly, the Whoop and now the Oura Ring will track your blood pressure. But there are also, internet-connected blood pressure cuffs, digital scales, pulse oximeters, right? All sorts of ways to start tracking all of this. But honestly, I think like smartwatches and other wearables like the Oura Ring and Oura Whoop are gonna get all that as well real soon. And so what we are trying to do is build the system. We are that kind of central point where you can safely store all of your health data in a HIPAA compliant, safe way that we'll never train on it, we'll never expose it, and you own it, right? We're not going to sell it. We're not going to do anything other than use it to help you. So we're coming out with all those integrations in the next couple of months. So we'll be able to look at all of your Oura Ring data and get all of that information and help you act on that. And so first off, a lot of that already exists, but then there are other like really cool, interesting things that I've seen coming out where, there are apps, and I don't know about the clinical accuracy of this. This is just you and I nerding out here a little bit, but they're getting there, right? Where they use your camera, and they're using the camera to essentially measure your heart rate and measure your breathing patterns and understand, based on your pallor and such, like how healthy you are. Those things are apparently getting better and better and better, and those machine learning patterns are super interesting. And so, listen, there are always going to be some things where you have to see a doctor in person for something, right? I don't know that your phones ever have something like a portable MRI or a portable X-ray, right? Like, I don't know, maybe 100 years from now, right? Maybe that's the Jetsons time. But where we are right now, it's moving fast into those basic monitoring pieces that your primary care doctor does, for sure. And it's really exciting because with an AI like ours or another medically trained kind of accurate AI, I don't know if there are any others now, but there will be soon. You can act on that. You can get real actionable data and understand it, and that's really important.
I actually think it's a hell of a mission because you said going internationally. I could, my brain started immediately going to go to parts of the world where seeing a doctor is almost impossible, and basic patient care would extend longevity by years because it's just not available. I mean. Yeah. I love the mission. I love what you guys do. I'm preaching to the choir. And you always don't see a solution that could impact that many people in this kind of breadth. Like, obviously, the Googles and the Open AIs, the Amazon, you see that global impact. And then once in a while, you see a product, you're like, oh, wow. If people actually start using this as a primary care, this could be an interesting shift in terms of how we actually take that first step of patient care.
I mean, we want to be that first step in patient care every time you need that first step, right? We want to essentially give our AI away for free forever. And there are lots of ways for us to ethically make money by just kind of passing you around through the healthcare system. If you need labs, a lab will give us $1 if we send them your way, right? If you need to see a specialist, we'll share our data with the specialist, and the specialist will look at all the data and say, "Oh, that was great." And then they'll send us $1 data sharing fee, whatever. We don't do that yet, and we'd only do that if you want it as a consumer. But we're starting to build those agents to help out with that, so that, for example, if the AI says, "Hey, look, you probably need to see a gastroenterologist," and you can see one of our primary care doctors, and if they confirm that, we can have our AI go and call the top 3 gastroenterologists in your area, see which ones take insurance, schedule that for you. Right? All of this coordination is just going to make your life easier and also make you healthier.
Fantastic. Matt, we could keep doing this probably all day because I'm fascinated by it, but you got to actually get back to doing the thing you're doing as well. If somebody wants to learn more, if somebody has a follow-up question, what are some good resources? What are some contact points?
Oh, yeah. I mean, so we are live at doctronic.ai. That's our website. You can also just do a Google search for AI Doctor. We're always the #1 result. That's pretty much it.
Okay. Fantastic. Matt, I appreciate your time. Thanks for coming on. Thanks for sharing.
Yeah, thanks so much for having me. So much fun.
Absolutely. All right, that's it for this episode. Be back again, different guests, different topic. Until then, 2 things. 1, I love the discussion around democratization of this healthcare aspect. Obviously, primary care is where we focus, talking to Matt, and he walked about some of the aspects of privacy. We talked about HIPAA. We talked about helping current doctors and what the impact is if we could actually help have an AI up front. And he talked about how they deliver patient care, and we covered a lot of ground. So hopefully you found this interesting. Please share this with somebody else who might as well. I'd appreciate that. Also, like, subscribe, comment. Let me know how the show is going for you. Until next time, thank you and goodbye.